Okay, welcome back. So hopefully you guys have had a look at the template for an unplanned CPD, and hopefully you saw that there's two distinct sections within that template, and those two distinct questions are exactly what the template for this GPHC is. So we haven't changed it or amended it for you guys as undergrads. This is at this current time what the GPHC template is for an unplanned CPD. The only things that we have updated is just to give you a bit of guidance on what to write on. So hopefully you guys saw that the very first question says that you need to describe what unplanned event or activity took place that enabled you to learn something new or refresh your knowledge or skills. So within this section, we expect you to write about two things. Yes, you need to write about the activity that you took part in, but also you also need to write about what you have learned, whether that's a specific skill, whether that's a knowledge, an attitude, or behaviour. So essentially, we want to know, what have you learnt now that you hadn't known before, or what can you do now that you couldn't do before? Okay. When you're saying what activity you took part in, it's really important that you're just quite concise and clear when you're writing about the activity that you took part in. So for example, if you say that I undertook for Study Smart something like one of the modules for Study Smart, for example, whether it was related to time management or stress management, you undertook one of these modules. It's really important that you are very clear with what you say that you've done. So we don't want you to say that you undertook a specific module for Study Smart, but also you attended a workshop over something completely different, but also you read an article related to a completely different topic. It has to be just one single activity that you took part in where you learned something new. Okay, so within this section, you will notice that when you start writing about what you have learned, if the initial activity that you have described is too broad, when you start writing about what you have learned, you will start writing reams and reams of information. Obviously, we want you to describe exactly what you have learned. So it's not enough for you just to say, I have learned how to manage my time, or I have learned how to manage about my stress. We want to know the exact skills that you have learned to help you manage your time, or the exact skills that you have learned to help you in managing your stress. Okay, so you have to describe exactly what it is that you've learned, but we don't want pages and pages of information. As soon as you start writing pages and pages of information, that could be a little bit of a hint that what you initially wrote in terms of the activity that you took part in is just a little bit too broad. But similarly, we don't just want one line or two lines describing what you've learned. We want it to be clear that you have learned something, okay, and what it is that you have learned. So that all goes in that very first section. The next section, the next question, is us very much asking you to give an example of how this learning has benefited the people using your service. So within this section, we want to know exactly how this learning has been beneficial. So we sort of recognise that you guys are undergrads, so we want to know how this learning has helped you as a student, but also possibly look forward and look into the future. So we want you to say how this learning will benefit customers or patients that you might encounter, whether you are doing a summer placement, whether you are thinking more forward as a pre-registration pharmacist, We just want to know how you think this learning will be beneficial or has been beneficial to you right now and any future events that you are going to be doing. So whether that's placement, or you might have a permanent Saturday job in a community pharmacy. So how has this been helpful to you? We also want you to give an example of where you have applied what you have learnt, okay? Because for us, this is the best way for us to see that you have actually learned something. So again, we know that you are undergrads. So if you haven't had the opportunity to apply what you have learned, we want you to give a very clear example on how you could apply what you have learned and how this is going to benefit the people using your service. Okay. Also within this section, we want you to write whether there's anything related to this topic that you'd like to learn more about in the future. So I will start giving you examples. So for example, you might have been on a placement, a community pharmacy placement. It might have been one day. And the activity that you took part in that enabled new learning, you might have observed a community pharmacist completing a controlled drugs prescription. So you might have learned that there's certain drugs that are controlled, they are locked away, they are managed differently to non-controlled drugs. There's a clear register where these controlled drugs have to be documented, so their name, the quantity that you have in store, the quantity that you give out to patients. And you might also have learnt that these controlled drugs are checked periodically to make sure that the quantities are up to date and nothing untoward is going on. You may also have learnt that when patients collect controlled drugs, it's done in a different way to patients that are collecting non-controlled drugs. Okay. In terms of how you have applied the learning, you may not have had the chance to apply the learning, but you could think forward and be like, oh, now I know more about controlled drugs, and the legalities around it, I'll be able to apply this learning to my dispensing classes in the future. When I start doing Saturday jobs, or when I go on another placement, I'll have more of an understanding and might be able to actually get involved in completing the register for a particular patient that's on a controlled drug. But also moving forward, it's really important that you know this learning, because it's legalities of a prescription. So it is going to benefit you in the future, because you need to know this, whether you work in community or hospital, whatever sector you work in. But also it benefits the patient in the sense that you will be able to respond efficiently to any controlled drugs requests because you know what to do. In terms of what you might want to learn in the future, so now you know controlled drugs exist, now you know that there's a certain system for controlled drugs. Moving forward, you might now want to learn what the different categories of controlled drugs are and what drugs are controlled. So what drugs are controlled and that fall under which category. So that might be a future learning that you might want to do. So as soon as you say, I want to learn about this in the future, actually you could follow this up in second year. And if you haven't learned it yet, you can just think, oh, in second year, I could write this up as a planned CPD. So that's just a very basic example of a CPD. Of an unplanned CPD. You've literally just learned something new right there on the spot. Another example is you are on placement, but possibly a hospital placement this time, and you are working on one of the examples, and when you are on the ward or seeing a drug history being taken, you learn that, for example, there's a certain class of drugs called DOACs that increase the risk of bleeding, and they should not be taken with other drugs that also increase the risk of bleeding, such as aspirin, ibuprofen, diclofenac. So that's something new that you have learned right there on the spot. It's beneficial because actually you don't want to increase the bleeding risk when it comes to patients. So it's relevant in community and in hospital pharmacy. So if you have a patient coming in to buy aspirin or ibuprofen and they're on one of these DOACs or warfarin, you know to counsel them to say that they should not take them. But moving forward, you might want to know more. So you might want to know exactly what those drugs are, what the names of those drugs are. You might want to know if there's anything else that they interact in. You might want to know how to counsel a patient taking one of these drugs. So again, that's something new that you've learned right there on the spot, but you're thinking about what you want to learn more of as a result. Okay. I've included examples of these are taken from the GPHC website, and I have to admit they are not the best examples of an unplanned CPD, but it's just to give you an idea. So this person is writing an unplanned CPD. In terms of describing what they have learned, they've said that they've attended a recent in-house hospital clinical meeting on peds nutrition, and they've written what they have learned. So they've learned about the different milk products, allergies, when they'd use all of them, and also about the hospital paediatric formulary. Okay. They have given an example of how this has benefited them, so it's improved their confidence and understanding, and how it will benefit them when they receive a prescription in the future. They've given an example of how they've applied the learning, but also it's triggered more learning for them. So they've said what they're interested in moving forward. Okay, so that's just a very brief example of an unplanned CPD. So again, to understand unplanned versus planned CPDs, unplanned is normally in the moment and it's one single activity. So it's very much starting from action. You have done something in the moment and you've learned something new right there, right then. Whereas a planned CPD, normally you need to think back and think, oh, I did not know something, or I do need to know something in the future. And you do more than one activity to try to learn what you have identified as something that you need to learn. Okay, and it's very much more in depth. Now, you might come across examples that can be written as unplanned or planned, and I understand that it can get quite confusing. So for example, you might think, oh, there's a conference that I've heard of that's going on, I'm really interested in going. So actually, it could be a planned CPD because you have maybe identified a knowledge gap, and one of the things that you wanted to do was to attend the conference to achieve that learning gap. But also, it can be written as an unplanned CPD because although you planned to go there, when you were in the conference, you attended a particular talk and you learned something new right there on the spot. So remember, there is a bit of overlap between the two, and it's all down to how you write it and how you present it. Obviously, for this year, you are presenting unplanned CPDs, so things starting in the moment. Okay. In terms of what you can
Now, in terms of how you can obtain your unplanned CPDs to write about, there's various opportunities available to you within the university setting and beyond where you can learn new things. So just as an example, every single term in autumn and spring term, there's something called Enhancement Week. And Enhancement Week is also known as Reading Week, but the university puts on multiple different activities for you guys to attend as optional activities. So for example, one of the things that takes place in Enhancement Week is Dementia Friends, where you can become a champion of dementia patients. And so you attend, it's a study day, and when you attend, when you do these extracurricular activities, you are essentially showing that you're going above and beyond the course, because it's not actually part of the course, it's not part of the routine lectures, it's not part of the routine workshops. You are actively seeking out new learning opportunities, and these are things that you can write about. Equally, when you have your talk from Dr. Bisley about your PADS portfolio, he's going to introduce to you, if he hasn't done so already, something called Study Smart. So Study Smart is opened to first year students only for a few months, and it teaches various things. There's various modules related to perhaps stress, time management and others that again you can sign up to, and at the end of Study Smart you also get a certificate as well. So you can write an unplanned CPD based on Study Smart. So the students that take advantage of these things actually have better portfolios moving forward. Equally, if you read an article that is relevant, that is related to pharmacy practice and pharmacists, then you can write about that as an unplanned CPD. And also if you attend an educational meeting and in addition to what I've listed, any placements, whether they're community hospital placements, or if you have a Saturday job, you will be learning new things on the job. What we do not want you doing is writing about lectures and workshops. So it's really important that you do not write about things that you've learnt in a lecture or things that you've learnt in a workshop, because if you think about it, the whole point of these CPDs and your portfolio is to show that you're going above and beyond the course, really, and all of you are going to workshops and all of you are going to lectures, so it doesn't really add anything or change anything. What we want to see is things that you're doing above lectures and above workshops. So it's really important you don't just populate your portfolio with lecture and workshop material. We won't be marking those very well. They will get low marks. Equally, we want to see a variety of CPDs. So, for example, say you come to Dementia Friends in your reading week, we don't want to see 6 CPDs all about Dementia Friends. We just want to see 1 CPD about Dementia Friends, and your other CPDs have to be related to other stuff. So we really need to see different topics and a variety. And now at the bottom, I've put various examples of what you could be observing when you're on placement, whether that's in community, hospital, or if you're working a Saturday job. So for example, if you notice that a patient has come in to be counselled, ask if you can observe the pharmacist counselling the patient. If the patient has come in for various over-the-counter medications, observe the questioning and observe what they get given. All of that is learning. If you are learning how to dispense and label, then write about that, and even the controlled drugs as well. So there are loads of opportunities for you to learn new things.
In terms of what support is available to you, there is various support available to you. So the very first thing I want you guys to know is under your student development portfolio, we've developed something called a Padlet, which essentially is a board that has a list of questions asked by yourselves. It's all anonymous. You can ask anything related to your PAD portfolio. So it's anonymous to other students, can I please stress? So yeah, it's anonymous to other students. We will see what you have posted. If it's related to anything related to CPD, I will answer to it. If it's related to anything that's related to your PADS portfolio but not CPD, Dr. Sam Bisley will answer it, okay? Obviously, we're not checking this every day. We'll probably check it every 2 months or so. So if you have an urgent question, you email us. But if it's just a general question for you just to understand a little bit more of the content, whether it's CPD or PAD portfolio, then you can by all means type it in here. And we've already left the questions on the board from last year, because just to give you an idea of what the guys were asking last year, to try to guide what you might ask this year. Okay, make sure you click on part 1, not part 2 or part 3. All right, so that's the first resource available to you. The second resource, needless to say, is on the GPHC website. Loads of information about revalidation as a whole on there, and I've put the link in for you. And obviously on the RPS website. So what you guys should probably do is sign up to the Royal Pharmaceutical Society. So it's free when you're a student. For us, we have to pay for it as qualified pharmacists, but as a student, it's completely free for you. And not only will you find out about conferences happening in your area, which is really helpful for your CPD, but also there's various different articles. You'll get the pharmaceutical journal, and loads of other resources are on there to try to keep your knowledge up to date. There's also an article on the pharmaceutical journal, which you can access, but also this book written by our very own Successful Learning in Pharmacy. There's a really good section on CPD in there, but remember, revalidation was done after the date that this was published. So it's very, very relevant, but you may see them talking about CPD from a different angle. So for example, referring to unplanned CPDs as starting from action. So just bear that in mind. But again, a really good book, and it's in the library.
All right, so where are we at now? Hopefully by the end of part 1, you will have 6 unplanned CPD entries, and I know that Dr. Sam Bisley will be talking to you, or has spoken to you already, about your PAD portfolio. If that sounds unfamiliar to you, it might be because you have not yet had that lecture, so wait until you have that lecture, and then you'll understand the context of your PAD portfolio a little bit better. But that is not to stop you from starting to complete your unplanned CPD entries. So by the end of part 1, you are meant to have 6 unplanned CPD entries for your part 1 portfolio, PAD portfolio. What we want you to do now, between now and next week, or when your CPD workshop is to have a go at writing an unplanned CPD. And the aim of doing that is for you to bring it into the workshop, the CPD workshop that we have planned and booked for you, and to use that as an opportunity to get feedback from us around your CPD. I just need to make it as clear as possible that we do not mark your CPDs as you go along throughout the year. From that point onwards, you're on your own, and when we are marking your CPDs and your portfolio, it will be as the final copy, and it will be a formal mark. All right, so use this as your opportunity to get feedback. I'm sure you guys must have learned something so far in the last few weeks, so have a go at writing an unplanned CPD, bring it with you, have it ready for your workshop, and we'll go through it. In the workshop, you will see that it'll be in your timetable. Have a look at when it is, but our plan is to review some CPDs around the measles, mumps, rubella vaccine, obviously for you to use it as an opportunity to bring your CPD in, get that reviewed from us, and also review each other's CPDs as well. So that will all be in the workshop next week, which is compulsory.
Hopefully the things that you should have learnt by now are these, and obviously the next job is to try to improve your skills and apply your knowledge to writing your own CPD and complete CPD entries throughout the year for your PAD portfolio. Obviously, this is a recorded lecture, but if you have any questions, my email is at the very front of the slide. But obviously, you will be seeing me in the face-to-face workshop for next week, so make a note of your question, and I'm more than happy for you to ask it to me then.